So what did you find?
Very small fracture.
Basically, my role here is the physician mentor. My job here is to mentor the Afghan physicians so that they can become better equipped and have a broader knowledge base of mainly Western type medicine. There's two ways to look at it. You can either learn from reading or you can learn by doing. These people learn by doing. In their system, they become a physician. They still go to medical school, but they're trained by senior physicians. And the senior physicians are, of course, trained on older techniques. So basically, they're worried that he had an anoxic injury, not enough oxygen going to his brain because of the time that he was down. There is a lacking sense of urgency a lot of times, you know, when a patient's dying or a trauma patient comes in. All right, let's move this out. Start getting undressed. Where's my doctors? Can you call again for my doctors to come, please? And where's the ER guys? You know, they'll stroll up to the patient, you know, kind of look to see how he's doing, and you know, versus us, you know, we'd get in there and start cutting their clothes off and start, you know, examining the patient and stuff like that right away. They don't necessarily do that. My job here is to be more hands-off, making them do what they can for the patient. Did anybody listen to his lungs and feel his belly? And
yeah, Dr. Nabi explained. By his idea, maybe this patient had vascular injury.
Okay, but, yeah, we're making assumptions without even examining him. Maybe he has a nerve injury, maybe he has a bone injury, maybe he has a bladder injury, maybe he has intestinal injury. We can make all sorts of assumptions, but until we examine him, we don't know what's going on. Actually, I take the same approach that I take with when I train my residents back home. Basically, I try and get them thinking critically. Try and do a lot of bedside teaching, and so we examine the patient while we are doing the teaching, examining the x-ray while we're doing the teaching rather than didactic lecture form. Any fractures?
Clavicle, no.
No?
Soft, no.
You sure?
Once again, we should.
Yeah, he had a thoracotomy, right?
Yeah.
So a lot of times when I ask them a question, they'll answer, the patient's good. The patient's fine. The patient's stable. We don't know what it was. So now, is his blood pressure good? How do you know? How do you know it's good? You know, constantly having to deal with these types of situations can kind of be a little mentally taxing. Can you, Chief Nias, take this call? The mission has been very rewarding. If I take a retrospective look to when I first got here to where I am now, I think they've progressed tremendously. Okay. Who's going to take them to the operating room? Dr. Nabi?
Yeah,
and Dr. Shamari? Okay, that's great. So you guys handle this. Dr. Weiss, you're going to be on anesthesia? Okay, so the rest of us can finish rounds.